Good morning, everyone. We're going to be working on Chapter 9, which is our antiviral drugs we'll be talking about. So with our antiviral drugs, just remember viral infections are very common. They're non-life threatening, and usually we do not need any type of antibiotic or anything prescribed for it, but then sometimes we do have to. There are some viruses such as hepatitis that can do a lot of damage, especially to the body. And if it's not treated, then time it can actually kill. But normally, if you get like a little virus or a common cold, it just takes some time and then it will go away. There's two types of viruses. There's the common virus and then the retrovirus, and we're going to be talking about both of those. And there's two types of antiviral drugs that we'll be going through, the antiviral drugs and, of course, the antiretroviral drugs. Common viruses, those are usually the non-retrovirus. They must enter the body in large numbers in order to cause a disease. Examples of that would be like chickenpox, shingles, measles, mumps, herpes, warts, hepatitis, and of course, like I said before, the common cold. Remember our immune system's job. It is very important because what it does is it removes or destroys these viruses. And a healthy person will not see any signs of sickness with most viruses until it takes over the normal cells and then the body is unable to take care of it. So that's usually when we get those, is not feeling so good and feeling sick. If our immune system cannot take care of the viruses, it will spread, and then if it's not taken care of, it can actually lead to death. So that's why we have to, watch out when it comes for the viruses. Now, antiviral drugs, they will not kill the virus, but they will suppress it, especially the reproduction part of it, and it will prevent it from growing. So that is the job, but it will not kill the virus. So if we keep the virus numbers low, then what happens is our immune system is able to take care of the infection and clear it out. So that is the good part about these antiviral drugs. So on page 140 in our book, I'm going to flip the page. But read up on the virus, look at the biology aspect of it, look at that. But on page 140, these are some of our common antiviral drugs. And acyclovir is one that we give a lot of. Amantadine, oseltamivir, Tamiflu for the flu virus, valacyclovir, Valtrex. Those are some of the big ones that we prescribe, especially oseltamivir, especially when flu time comes, we give it a lot. And we give a lot of acyclovir, especially people who come with herpes breakout, we will give that. So those are some of the common ones. Now, antiviral drugs, the first one we're going to be talking about is acyclovir and valacyclovir. Okay, these make fake DNA and they will actually stop viral DNA chain. So on table 9.1 and page 141, you can actually see the diseases caused by specific viruses. So you can look at that. There's other viruses out there. Of course, now we have COVID. We also have like the Zika virus. That was the one that we've had before out there. So there are many different viruses out there. But like I said, COVID, that's the new one. We know all about COVID. Now with acyclovir and valacyclovir, the side effects, and you can see that on page 141 in the book, the little pictures. The most common side effects for that would be headache, dizziness, nausea, and vomiting. Now, adverse effects for those two medications, of course, if you give it IV, you could have pain and irritation, of course, at the IV site. These medications do decrease kidney function. So that, and if we decrease kidney function, that could lead to kidney damage, and then it can cause kidney failure. So we must make sure that when they're on these, because we must keep them well hydrated while they're on these medications, so they need to drink a lot of fluids, because what happens is with the kidney damage and all that decreased function, it actually, the drugs cause precipitation in the kidney tubes. And if we cause that precipitation, then that's when we're going to get kidney damage and the kidney failure. So that's why it's very important when they're on these medications, we inform them to drink lots of water to prevent that precipitation forming in the kidneys. So before we give these meds, if they're on Dilantin, which is phenytoin, and that is for seizures, It will decrease the effectiveness of this medication. So it will decrease the effectiveness of Dilantin or phenytoin if they're taking it with acyclovir or valacyclovir. So if it makes the Dilantin or phenytoin decrease effectiveness, that can actually lead to a seizure. So they may need to readjust the seizure medication. We wouldn't mess with the antiviral drug. We would have them adjust the seizure medication while they're on the med until the viruses, the antiviral drugs are over and out of the system. Now, it's very important if we give it IV to check the IV site, flush the line very well. We want to make sure the drug is given very slowly, over about 60 minutes, to prevent those kidney problems and, of course, irritation at the site. So we want to make sure we do that if we do give it IV. Afterwards, like I told you before, we want them to drink a lot of fluids. So if we give an oral form, we definitely want them to drink a full glass of water. We're going to remind them to drink water throughout the day to make sure we keep those particles from building up in the kidneys. That's very important. We don't want kidney failure and we don't want kidney damage. We're going to make sure we teach the patient, don't stop the medication even if you're feeling better, because what it's doing is suppressing that virus. And if you stop it, what is going to happen? The virus is going to regenerate. So we definitely don't want those symptoms coming back and reoccurring. And then it also makes them resistant to those antiviral drugs. So that's why it's important to make sure we inform them, even though you're feeling good, take the medication until it's completely gone. Also tell them to take the drug evenly throughout the day. Over a 24-hour period. So if it's ordered twice a day, make sure they take it every 12 hours, like 9 a.m., 9 p.m. If it's 3 times a day, take it every 8 hours. 4 times a day, every 6 hours. You want to try to keep that blood level nice and steady to help keep that virus from regenerating and keeping it down. So we definitely want that. And like I said, very important to drink a full glass of water and encourage them to drink at least 3 liters of fluid daily to prevent that that precipitation in the kidneys and causing the kidney damage. So that's very important. Now, the pediatric population, when we're dealing with these 2 meds, older than 2, the dosages are similar to the adult doses. Pregnant and breastfeeding population, low likelihood of birth defects or fetal harm. It does pass through the breast milk, so we may want to teach them to either not breastfeed while they're on the med or do the ways of decreasing the exposure, like maybe expressing milk before they take the next dose, breastfeeding before they, take the next pill. But the best thing is just to tell them to stop it until after they're done with the medication, and then they can start up again. Now, our older population, we know that they're going to have the most complications. So they're the ones that have the dizziness. They can have agitation, confusion, and these are side effects for our older population. We will see them more because of their kidney functions change as you get older. I told you the aging process works bad on your liver and your kidneys. So in this case, think about it. Throughout their lives, they've been using their kidneys. Over time, things start to go down. So kidney functions get bad. So we want to make sure we watch the kidney functions. That's why we see a lot of dizziness, agitation, and confusion on them. And because it's not getting rid of the medication like it should, so you're retaining more of it in the body. So another thing that's a big concern because of the dizziness, confusion, agitation thing, safety is a big concern. So we do not want them driving while they're on this medication. Acyclovir and valacyclovir works on many viruses, and you can see that in the thing like the herpes. We give a lot of it for herpes simplex, type 1 and 2. It also works on the varicella zoster virus, shingles, Epstein-Barr virus. So it works on different viruses. And of course, I would not ask you what virus does it cover. You can look for that in the book. So that is the first 2 antiviral drugs that we're going to go. Now, the second one of the antiviral drugs is the adefovir and dipivoxil. Those are the next ones we're going to, let me see. And that is, okay, so adefovir, I can't even say it this morning. I've been up all night. Dipivoxil. That is the medication we're going to be talking about, and it is starting on page 142. The oral drug is effective against hepatitis B virus, and you know, as a worker in the healthcare field, that is the biggest hepatitis that we're more concerned about, is that Hep B. We are big time worried about that. It does work especially on the liver cells because hepatitis, liver, surprise, surprise. We want to make sure that they realize when they're on this, they're going to be taking it for months, sometimes years, if they're on this medication. So the side effects, I mean, you will see that page on that page also, is nausea and vomiting and abdominal pain. So it causes a lot of belly issues. Now, adverse effects, black box warning. The black box warning is telling you that it's very, very highly liver toxic and kidney toxic, okay? And they interact with many antiretroviral drugs. So we have to watch with those. So those are the adverse effects. So liver and kidneys we're concerned about, and they're bad with the antiretroviral drugs. So we want to make sure we teach our patients, hey, if you stop the med, you can have an acute exacerbation of your Hep B symptoms, and we do not want that. So continue the medication. If you have issues, talk with your physician. If any, report any yellowing of the skin or eyes, that dark tea-colored, cola-colored urine, or of course those light-colored stools. I told you, like sandy, tan stools. Those, again, are signs of liver toxicity, as well as the right upper quadrant pain of the abdomen, because that's where the liver is located. So if any of those start occurring, they need to report that ASAP to the physician, because that means liver issues are starting. Of course, we always want to monitor their urine output and report if they have decreased urine or any problems, because that could be a problem for kidneys becoming toxic, so we're concerned about that also. This med interacts with a lot of other meds. So we have to tell them if you're going to plan to take anything over the counter, if you're going to take any supplements, to make sure they talk with their physician beforehand, because a lot of them can interact and cause issues, so we don't want to do that. Because it's liver toxic, we definitely want them to avoid alcohol and no acetaminophen or Tylenol, because that is, works on the liver. Now, the pregnant and breastfeeding population, moderate likelihood to cause birth defects or fetal damage. It's not to take the med unless the benefits outweigh the risk. So if this is the only thing that's going to help, then definitely we're going to take it for the Hep B, because if you don't take it, you'll have more problems. So that's an issue with that. And it is definitely, it does pass through the breast milk, so it is not recommended at all to breastfeed. Now, our older population, again, we have to use very cautiously with them, especially for patients over the age of 65, just due to the fact that kidneys and liver, they start decreasing their activity as we age. So we are looking for a lot of chronic disorders, if they've had any history of any problems, because we want to make sure we report that before we start these medications. So that is the second antiviral drug. Now the third one, we have two of them, and these are going to be, these are, I know they're somewhere in this book. Always have to look as I flip the page. On page 143, and that is amantadine and rimantadine. These are ones we usually give for influenza A viruses. The side effects for them, of course, are going to be for your amantadine, the side effects are a lot of anticholinergic effects, and these are the substances that block the neurotransmitter acetylcholine in the brain. So what you're going to have a lot of issues are blurred vision, dry mouth, hallucinations. You can also have orthostatic hypotension and dizziness. So I always kind of think of like, drying up effects, like blurred vision because your eyes are dry, a dry mouth. You know how people in the desert, when they don't have water, they start hallucinating like they can see water. So hallucinations. And of course, if you're dehydrated, think about you can have orthostatic hypotension and it can make you dizzy. So that's how I kind of try to remember those side effects for it. Now, side effects are less when we give Romanidine. Okay, so we're going to see more with the Manidine side effects, less side effects for Romanidine. So more for Romanidine, less for Romanidine. Now, adverse effects, on the other hand, Amantadine will affect the central nervous system. So that's a big thing. Also, because it causes dry eye, our big concern is people who have glaucoma or people who have urinary retention. We should know that if they have those, because these medications will make those conditions work because it's drying up. So if they do have any complaints of glaucoma, we're concerned about it because when it dries the eye, that's going to increase interocular pressure and can lead to blindness. So we need to report that if they have had a history and the doctor's not aware. And with the urinary retention, because of the drying effects, what happens is that the patient can't pee as it is because they're retaining a lot of fluids and it can cause more issues. So we want to make sure that we report that. And they shouldn't really take this medication if they have those problems. Now, the psychiatric patients can be at increased risk for suicidal thoughts. So if you do have any psychiatric patients, you want to make sure that they monitor them. And if they have any suicidal thoughts, they need to definitely come in and get help for that. And now, that is for Amantadine. Now, with Romanidine, adverse effects are going to be less and they will increase more if you increase the dose. So you're going to see more effects with Amantadine than, again, Romanidine. So before we give, we're going to always ask the patient, hey, any history of glaucoma or urinary retention? And usually we'll see urinary retention for a lot of our male patients, especially with BPH in large prostates. The psychiatric patient, we need to know severe depression, do they have a history of any suicidal attempts or suicidal thoughts, because this could boost them up and make things happen. And of course, we're going to notify the doctor before we give this med to make sure that they're okay with us giving them, because we know that's an adverse effect about the glaucoma, urinary retention, of course, the suicide part. We also have to remember to teach the patients don't stop the medication. Patients will be at risk for falls. So we're going to make sure, because the orthostatic hypotension, so we want them to sit for a little bit. Safety is going to be a big concern. Also, because of the dizziness, we don't want them falling. So we want to make sure that they sit a little bit before they get up. We also want to make sure if they're going down steps to hold side rails, because safety is going to be a big concern. And of course, if they do develop any issues with depression or thoughts of suicide, that needs to be reported ASAP. Now, our pregnant and breastfeeding population, moderate likelihood to cause birth defects. It is found in the breast milk, so it's not recommended, definitely not to be recommended to be given during the first trimester of pregnancy or breastfeeding. So that is not recommended. In our older population, dose should be reduced for patients over the age of 65. It can make heart failure and edema worse, because you're retaining a lot of fluid. And if you have a history of heart failure, if you're not getting rid of the fluid, what happens? Makes your heart work more because you're retaining it. So heart failure can be worse. And what's going to happen? A lot of fluid's going to be pushed out in your extremities and cause edema. So it's very important for people who have a history of heart failure to weigh themselves daily and report if they have a gain more than 3 pounds in 2 days. So 3 pounds in 2 days. We also want the older population to measure their pulse daily and report if it becomes irregular or hard to find. So that's the third 2 meds in that. So the fourth one is ribavirin. And ribavirin, that is on page 143. No, that's Manidine. Sorry about that. That is on page 144. You're going to see information on that. At least the side effects and all, it starts actually on the other page, but that's where you're seeing. These ones suppress many viruses, usually prescribed after you've tried the other antivirals, because it does have severe side effects and adverse effects. So this isn't the first one we're going to be given. We're going to try other ones beforehand because of that. They do treat the hantavirus, hepatitis A, hepatitis C, RSV, that happens a lot with kids, West Nile, so that's what you're going to see used for that. But with the side effects, nausea, vomiting, diarrhea, fever, headache, conjunctivitis, muscle pain, fatigue, dizziness, and if you do give an injection, you can have pain and irritation at the injection site. So those are some of the side effects with it. Now, adverse effects. It is a teratogen. So remember what I talked about teratogen? It can cause big time birth defects. So it should never, ever, ever, ever be. This is important. Remember, this medication shouldn't be given if someone is pregnant or breastfeeding, or it should not be given to anybody planning to become pregnant, and it shouldn't be handled or inhaled while pregnant. Okay, so ribavirin should not be around any pregnant individual, because if they inhale it, it could cause death to the fetus. So we don't want that, because it is definitely bad, 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 and could cause huge, huge birth defects. So we do not want them to touch the pill. We don't want them to be around it. If we're opening it up or opening a bottle, they should not be around it. They should avoid it at all costs. So if they're going to be placed on this medication, if this is the last resort, they're definitely in the female population. They're going to be checking to make sure that they're not pregnant. And while they're on this medication, again, remember, 2 reliable forms of contraceptives. Okay. So that's big, big thing. I think there's like a star somewhere. I would think a star should be starred on that one. Another adverse effect that it does is it suppresses bone marrow production. And anytime we suppress bone marrow production, we are affecting many things. We're affecting red blood cells, we're affecting white blood cells and platelets. And we know if we do that with the red blood cells, we're going to cause anemia. If we suppress the white blood cells, we put the patient at risk for infection. And if we, suppress the platelets, we can cause bleeding. So those are the big three. Anytime you hear bone marrow suppression or suppressing something, usually it's going to be white blood cells, red blood cells, and platelets that we have to be concerned about. So that is another adverse effect that can occur with that bone marrow suppression. Now, long-term use can have some liver and kidney, as well as heart and ear problems. And actually, with this medication, it can lead to some forms of cancer. So that's why it's not the best med, because it has those nasty side effects and big-time adverse effects. So what are we going to do before when we give this medication? We're going to make sure we check a heart rate, rhythm, and pulse, because we know it can affect the heart. We're going to check the lungs function. We're going to make sure we check a rate. We're going to check a pulse ox depth, the breath sounds, skin color, mucous membranes, and also level of consciousness. We want to make sure we know level of consciousness. We're going to check kidney functions. Are they urinating? Is their output is good? Check their BUN and creatinine levels, make sure they're functioning okay. And we may want to check them while they're on this med. We're checking the liver functions. We're looking for signs of jaundice, the yellowing. Of course, we're going to also do a liver function test. We're going to check the patient's hearing, because we know it affects the ears. We're also going to be checking the white blood cells, red blood cells, and platelets, because we know it suppresses the bone marrow. And we're also going to check a temperature as well as mental status. These do interact with didanosine or Videx, which is an HIV virus medication. It can cause severe liver problems and death from liver failure. So they shouldn't prescribe those 2 medications together. They do give ribavirin at least 1 hour before or 2 hours after an antacid. So it's very important to make sure we give it 1 hour before or 2 hours after we give an antacid, because it will interfere with the absorption. So we can't do that. After, what are we going to do with ribavirin? We're looking for any of those side effects, any of those adverse effects that occur. We're going to make sure we have them come in and check lab values. So we're going to have them come back in and make sure they do a BUN and creatinine level to check those kidneys, liver function test to check the liver. We're going to check the white blood cells, red blood cells, platelets, do a CBC with diff to make sure that bone marrow suppression, that none of those issues are occurring. We're going to monitor the urine output. We're going to check for hearing daily, and we're going to make sure we document and report any significant changes to the physician. We're also teaching the patient about the antacids. Take the medication 1 hour before or 2 hours after an antacid is given. Any allergies or adverse effects, we're going to report that. And they should not stop the medication unless they're having big time issues and they talk with a physician, or a physician tells them to stop it. They need to keep on it because otherwise it's going to reoccur. And that's why we have to do that. Now, pregnant and breastfeeding population, high likelihood of birth defects and fetal damage. It should never be given. Two reliable forms of contraceptives, especially if they're childbearing age. And males on the medications, if they do have any sexual intercourse, they need to use a condom, because they can expose, if a woman is pregnant, they can actually expose that woman to the medication and cause problems. So they have to wear condoms if they're going to have any sexual activity with a pregnant woman. And of course, the pregnant population shouldn't be anywhere around those pills, should not touch those pills. If they're being taken, they should not be around because it will cause issues with the baby. Now, our older population with this med, of course, risk for the organ toxicities. We always are going to start them at a lower dose, and they are at high risk for anemia. And the aerosol form, not indicated for this population. That's another thing for the pregnant population. If they do the aerosol form, they cannot be anywhere near that room because it will cause birth defects. But our older populations, it's not recommended for them. So that is the fourth one. Now, the fifth one we're going to talk about is of antivirals is your oseltamivir and your zanamivir. These ones treat influenza A, B, as well as the swine flu. Oseltamivir will treat bird flu or the aviation flu or H5N1, especially if it's in a high dose. Usually the onset, the only thing with that, because of the flu, if you don't catch it and get treated early enough, it's really no purpose in taking the medication because it's not really going to cure. Again, it does not cure the virus. It only helps suppress those symptoms. So onset of the flu symptoms, if you want to get oseltamivir, you have to get it and take it within 12 to 48 hours. After that time frame, it ain't going to do nothing for you. And then for the zanamivir, you need to take it within 12 to 36 hours. And if you don't take it between that time, it's not use. That's good. So a lot of times people that come in with the flu, they're like, well, why aren't you giving me some medication? Because it's way past the time. If you don't come in before that 48 hours, we're not going to give you any oseltamivir. If you don't come in before that 36-hour time frame, zanamivir is not going to really do anything. So it's more like helping you, drink fluids, rest, take some Tylenol or ibuprofen if it's not contraindicated. And that's the way to treat it, because otherwise, if you don't get it early enough, it's not going to do anything for you. You just got to ride it out. But like I said, it will prevent the influenza developing after exposure. Side effects for oseltamivir. Let's see, it can cause nausea, vomiting, diarrhea. It can cause some dizziness and headache. Zanamivir, if it's inhaled, the inhaled form can cause nausea, diarrhea, can cause a cough. It can also cause a headache and nasal congestion. Usually oseltamivir comes in a liquid or capsule form. There's the cough. So those are some with the side effects. Now, adverse effects for these. Oseltamivir is rare, but it can increase your blood sugars. So we have to watch and monitor our diabetic patients. That's very important because their blood sugars could be elevated. So they need to check their blood sugars more frequently. And it also will increase your liver enzyme levels. So we need to monitor those. Monitor them before we take them as well as afterwards. Zanamivir for adverse effects, it's rare, but you can have problems breathing, confusion, and seizures. So that's not uncommon for that. So what do we want to do? Let's teach our patients about these meds, how to take them. Liquid form, oseltamivir. If it's the inhaled form, it's going to be zanamivir. If it's going to use the inhaler, we do not use a spacer. Okay, we'll talk about spacers when we are working in respiratory chapter. So another thing very important, if we're using an inhaler, if the patient has a respiratory issue as it is, if they have a bronchodilator, it's very much encouraged that they use their bronchodilator to open up the airway. Then we recommend they wait 5 minutes and then take their inhaled form of the zanamivir. If they don't have a bronchodilator, then just take the inhaler as prescribed. But if they do have a bronchodilator, it is recommended to use that first, but you have to wait 5 minutes between inhalers. So 5 minutes between inhalers. Of course, if any adverse effects, we recommend them to hold the dose and report them as soon as possible, because the doctor may want to switch it, take them off of it, do something else. But like I said, on page 140 is all your common antiviral drugs, listed. So you can look at that. So those are your antiviral drugs. Now the next thing we're going to talk about is your retroviral infections. And with retroviral infections, what do we take? Antiretroviral drugs. And there's a lot of those that are going on it. And with our retroviral infections, these are diseases that can occur with low levels of retrovirus. Now, this is where we're going to be dealing with HIV as well as AIDS. Now, HIV we know is a human immune deficiency virus. It is a retrovirus that can attack the immune system. We know that of a person infected, which will lead them to little or no immunity at all. They will have no protection. That's why the majority of the time you don't hear someone dying of HIV or AIDS. You're hearing them die due to pneumonia or some type of infection because they have no immunity. So that's the big thing. The most severe form, like I said, of immune deficiency disease would be caused by HIV, of course we know, is AIDS, which is the acquired immune deficiency syndrome. HIV affects that CD4 in T cells, and these are the generals of the immune system. They're like the general armies, and they help the immune system. CD4, that is a type of white blood cell that will actually fight infection. It's also known as the T helper cells. So you heard a lot about checking the T cells. That's what it is. We're looking for those CD4 cells, the T cells that do infection. Patients with this are more likely to have bacterial infections, fungal infections, viral infections, and actually some cancers. So that's not uncommon. They're at risk when they're on these medications of those things developing. So with our antiretroviral drugs, they will actually suppress the replication of the retrovirus. Again, they're not going to cure it. They're going to suppress it down. And that's what we want. So they need to take this medication faithfully. They need to not stop this medication because it can cause a lot of issues if they do stop it. So we're going to talk about that as we go. So surprise, surprise, we can't make it simple. There are 6 classes of drugs that we will discuss. Okay. Now, when we talk about HIV, a lot of times if you deal with HIV patients, patients a lot of times will say, I have to take my cocktail. Okay. And a cocktail is just many different antiretroviral drugs that they have to take. So it's a different variety that the doctors determine what they want, and then they get that cocktail to take. So when you hear cocktail and HIV patients say that, then you'll just know it's a lot of antiretroviral drugs that they're taking. Now, when you hear HAART, H-A-A-R-T, which means highly active antiretroviral therapy, this is the approach of the different drugs in the cocktail. So if you hear HAART, that just means it's how they approach and what they're going to give. Like I said, doesn't kill the virus. Doesn't kill the virus, it just suppresses it. That's important. The HAART, the H-A-A-R-T, not the bump, 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 they can develop drug resistance to it, especially to the HIV virus. And this will actually lead to the HIV virus not being suppressed any longer. So sometimes it can cause resistance. That's why we don't delay, skip, or decrease our HAART doses. Okay, we want to make sure they don't delay it or skip them because this can actually cause that problem. We want to make sure that blood concentrations are low. This allows the virus to replicate and produce new viruses that are resistant to the drug. So that's why we don't want them to stop it, delay it. And that's what's going to cause an issue with our HAART medications. Now, because of that, does that mean that they can't take any more? No. Because we want to make sure we tell them to take it on a faithful basis. Do not skip doses. Take it completely as prescribed at the correct time. Be faithful taking it. If they don't if they delay, skip, decrease their doses, that's when we're going to have the virus reproducing, replicating. And it's going to make those heart medications resistant to it. So what happens is the physician has to make a new cocktail of different antiretroviral drugs for them. And then we have to encourage the patient, please take your medication on time. Do not stop it. So that's what happens with the resistance to it. They have to be faithful. They can't delay, stop. That's very important for that, our teaching. Now, antiretroviral drugs can cause allergic reactions. They do cause rashes. They can cause anaphylactic reactions. We have to be very careful. They do have a lot of adverse effects. They're very, 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 very bad on the liver. So liver toxicity. They can cause hyperglycemia. So of course, hyperglycemia, we have to watch our diabetics. They do interact with a lot of other foods or drugs. So it's very important that we get a list of everything they are taking, all the meds they're taking, and that includes supplements and over-the-counters, because they will interact with so many drugs, because if they're taking a cocktail, that's many drugs that they're taking. So we need to know what meds they're on because it interacts with so many things. Also important to get a drug allergy. Always ask about drug allergy. We're going to make sure we check their liver function test before we give it, during, and throughout the time. We're going to make sure our diabetics, we're checking their blood sugar more oftenly because we can have hyperglycemia. So we would be adjusting their diabetic medication, not the antiretroviral drugs. So we would be adjusting their blood sugar through the diabetic medication. Some need to be taken with food and others on an empty stomach, and they will be taught that depending on the cocktail. Afterwards, we're always going to be checking for jaundice because we know it affects, it's really, 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 really bad on the liver. We're going to be checking the blood sugars, especially our diabetics, because it increased the blood glucose level. And we're checking the skin because I told you it can cause a lot of rashes. So rashes, itchiness, blisters. We're going to be looking for any anaphylactic reactions. Take them as prescribed to maintain that beautiful effectiveness of the heart drugs. If you miss a few doses, that's going to promote that drug resistance. We do not want that. A lot of times people think that, because of the resistance, they can't take it, but they can take it. We just give them a different cocktail. But we want to encourage them, do not stop it because we want to prevent drug resistance. We also are going to tell them it's not going to kill the virus or cure the disease. It's only going to decrease the virus numbers in the body. And any signs of liver toxicity, the yellowing of the eyes, the urine, the right upper quadrant pain, those tan stools, they need to report that ASAP because that's actually liver big time. So now let's talk about the different types. And like I said, there's many we're going to go through. The first one we're going to talk about is our nucleoside analog reverse transcriptase inhibitors, which is our NRTIs. And these are on page 149, the dosages. Side effects for these: nausea, an important thing, intolerance to fatty fried foods. That's a big one. Let me just say that's a big one. And a headache. Okay, so a lot of times they will get a lot of belly issues if they eat fatty fried foods. It's going to cause a lot of stomach problems if they do that. So they are encouraged not to eat any fatty fried foods while they're on the NRTIs. Adverse effects, we already know it's a liver thing, so liver toxicity. And with this one, if they're on it for long-term use, it can cause peripheral neuropathy. So they'll complain about pain in their legs, numbness in their legs. So it can cause some peripheral neuropathy. Now, abagavir, you can have some hypersensitivity reactions for the first 4 weeks. So a lot of times people say, I have some flu-like symptoms. I'm just not feeling good. So with this group of medications, we're going to teach the patients avoid those fatty fried foods because it actually can cause upset stomach. Like I told you, the diarrhea, not feeling good. And it can also cause pancreatitis. With the peripheral neuropathy long-term, we just have to tell them, be careful, especially if you have neuropathy of the legs, risk for injury and falls because you don't feel anything, that loss of sensation that you have, and we don't want them getting hurt. If you're taking abagavir to stop and notify of any flu-like symptoms. Because if you do get flu-like symptoms, if you're taking abacavir, you will never, ever, ever be put on that drug again. Okay. Now, a pregnant and breastfeeding population, big thing for them, and this is kind of important too. Big thing, I told you I'd tell you with pregnant and breastfeeding, increased risk for lactic acidosis. Okay. So if any time the pregnant population is on this medication, and they kind of have to take it during their pregnancy, otherwise it's going to increase their risk of having issues. So they kind of have to take it while they're pregnant. It's a given situation. They can't stop it. It's going to be bad on the fetus, big time risk for issues, but nothing you can do about it. They have to take this, otherwise the replication is going to be bad. So they are at risk for this lactic acidosis. And lactic acidosis is a bad thing. That's where when they start complaining of muscle aches, if they're very tired, can't sleep. If they have abdominal pain, it can cause decreased blood pressure, slow, irregular heartbeats. They need to report it. And usually the first thing that they'll be talking about is the muscle aches. And they need to remember lactic acidosis, bad, 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 bad for this group. In our older population, safety is going to be a big concern, especially the peripheral neuropathy, because they're at increased risk for falls and injury. So they have to be very careful because they don't feel their legs a lot of times. So that's the first one. Now, we're going to talk about the NNRTIs, which is the non-nucleoside analog reverse transcriptase inhibitors. And these are on page 150. Now, these names have a VIR in the middle, okay? Side effects, rash, nausea and vomiting, headache, abdominal pain. You know, problem sleeping, vivid dreams or nightmares. That's a big one. They have these bad, very vivid nightmarish dreams. And adverse effects, anemia and liver, okay, liver toxicity. We want to make sure we teach the patient, report if they develop any sore throat, fever, rashes, blisters, or burning. This is another one that they need to take 1 hour before or 2 hours after an antacid because it will interfere with absorption. They do need to be checked for anemia because it can cause anemia. And very important, they cannot take St. John's wort. If they take St. John's wort with the NNRTIs, it will actually decrease the effectiveness of the med, so they should not take it. Pregnant breastfeeding population can cause birth defects. Some you can take anytime during pregnancy, some that you cannot. But like I said, a lot of them you should not be taken, but they have to take the medication. It's just one of those things. In our older population, they definitely need to tell the provider all the drugs they're on because remember, they interact with so many things, and as well as over-the-counter and herbals and all that. Because that's a big issue, and they need to check their pulse and assess for irregularities. And if they do have any irregularities, they need to report that to the physician. So that's the second one. Now, our third one is our protease inhibitors, our PIs. These are on page 151, the common one. Now, these ones, the generic name ends with a NAVIR, Navir. So the endings for our protease inhibitors, NAVIR. These ones will prevent HIV replication, prevent the release of HIV particles from infecting the cell. Now, side effects for these meds, headache, diarrhea, abdominal pain, weight gain, problem sleeping, and depression. So those are some big things with it. Now, adverse effects, again, liver toxicity. These ones will actually increase your lipid levels, which will cause hyperlipidemia, which we know with hyperlipidemia that puts you at risk for arteriosclerosis, as well as it can cause pancreatitis. We would never, ever, ever want to give this to anybody who's a hemophiliac because it will cause uncontrolled bleeding. Atazanavir and ritonavir can actually interfere with the heart conduction system, which will lead to heart block. So we need to watch people, especially if they have slow heart rates, because it's going to block the conduction system. So a lot of times we have to teach patients how to check their pulses daily. So of course, we're going to teach them to take their pulse for a full minute. Any changes reported, because especially if it gets slow, that's an issue. So we have to make sure we do that. And of course, we said no St. John's wort. No St. John's wort with this one because it will decrease the effectiveness. So avoid it like the plague. So remember I told you, put that on paper. Older adults report all meds they take. They need to monitor their pulse for any irregularities for the PIs. Now, the fourth one we're going to talk about is the integrase inhibitors. These ones are also prescribed for HIV disease, especially if they're already on a heart regimen and having increased viral issue things. So if they have like a lot of HIV in their blood, it will help with that. Doses is on 152. Okay, side effects, a lot of belly issues, nausea, vomiting, diarrhea, abdominal pain, no sleepy, insomnia. They can have headache and dizziness. Now, adverse effects, raw ticagrelor can cause anemia. It can increase your blood sugar, so we have to watch our diabetics. It can cause muscle pain and weakness, and that is our rhabdomyolysis. That's a bad thing, rhabdomyolysis. Anytime a patient complaining of pain in their muscles, they're very weak, we need to make sure we report that. Especially if they're taking statin drugs, and statin drugs help lower lipid levels. That's my little cousin crying. Not my cousin, my little nephew. He wants to come in and see me. But anyway, it will cause a lot of muscle problems, which are rare, okay? So that's why we want to make sure we tell and report if they're on any statins. If they're taking those, then that is going to be issue. Now, dolutegravir can actually increase the liver enzymes and also increase blood sugar. So those are some of the adverse effects for the integrase inhibitors. So we're going to teach the patients, especially with raltegravir, don't crush it or chew it, take it with food. Dolutegravir, it doesn't matter if you take it with or without food. It doesn't matter. If it upsets your stomach, take it with food. If it doesn't, don't. It doesn't matter. Definitely we want to make sure they report any muscle pain because of the rhabdo. And if they're on statins, they need to report muscle pain because that's going to be an issue. And report that ASAP. Of course, we're looking for signs of anemia because we know, especially if they're on raltegravir, it can cause anemia. So we're looking for those signs of anemia: fatigue, paleness, increased heart rate, shortness of breath. Report that as soon as possible. Our diabetics, we're going to monitor their blood sugar because they may have to adjust their meds. Pediatric population, not approved for kids. Pregnant, for the raltegravir, moderate likelihood of causing birth defects. Dolutegravir, low likelihood of causing birth defects. And of course, our older population, they're going to be on those statin drugs for, for their lipid levels. So they're going to be at increased risk for those muscle weakness. And if that happens, they're at higher risk for falls. So that is a big thing we also want to watch for because our older population, we are concerned about. All right. So our fifth one we're going to talk about is our fusion inhibitors. And this is only one drug, and it's enfuviratide or Fuzeon. So think of fusion inhibitors and the, Fuzeon, Fuzeon. It's a sub-Q, 90 milligrams. It is part of the heart regimen. It will block that viral protein from fusing to the cell host. But it has a side effect, and that is injectables. You can have the injection site reaction. It does cause some constipation. If you notice, these meds cause insomnia. It does cause muscle aches, and it can cause depression. Adverse effect for this one would be peripheral neuropathy. So they'll get the numbness of the hands and the feet. It can actually increase respiratory infections, pneumonia, and again, liver toxicity is big for this one. So the big thing we have to do with this one, because it's an injectable, it's a sub-Q given twice a day, we do need to teach the patient how to prepare and give the medication, and if they won't, we have to involve a family member. We also have to, if they develop any signs and symptoms, especially respiratory infections, report that immediately. And of course, if they have any developed peripheral neuropathy, we're going to teach them the importance of making sure that they watch themselves. In our older population, they are going to have problems with the injection because issues with the site, like their hands, sometimes their hands aren't perfect. So they may, or they might not be able to mobily do it. So we might have to teach someone else, especially a family member. And we have to watch neuropathy with them because they're at risk for falls because they don't feel when they're walking. So that is the fifth, only one. So think of Fuzeon, and even if you can't remember, I know these are a lot with the name-wise, but it says Vir, so there's an F, but that Fusion will help. The sixth one, and the last one is the entry inhibitors. And then we have Maraviroc, and we have Cellzentry. These ones are usually given twice a day. They are given by mouth. The side effects, muscle aches, pains, coughs, diarrhea, dizziness, and insomnia. They do have some lesser side effects, like they can have rhinitis, sinusitis, depression, numbness or tingling of the hands and feet again. Adverse effects, hypotension, and again, liver. All these are going to affect the liver. So we're going to teach the patient with this ones, they cannot pressure chew them. They do have to watch their position because of decreased blood pressure and dizziness, and they cannot drive with this because of the dizziness, so they have to monitor. Not approved for kids. Older adults, of course, the orthostatic hypotension puts them at risk for falls, and we shouldn't have them driving because of the dizziness also. So basically, that is the antiretroviral drugs. Now, there is some types of pre-exposure prophylactic or PR-EPs. So these are the ones that we give to the people that are HIV negative, but have either possible being with an HIV positive person. Okay, so these are those pre-exposure ones. Now there's new ones out there, but the one that we have in the book is Truvada. Okay, and it's a combination drug. Truvada it's N-trictibine and tenofovir, but Truvada is the PrEP. And there's like new ones, and you see them always on TV talking about, taking the pill before they go do things. But we're given, like I said, to HIV-1 negative sexual partners. Okay, so they're negative with a known HIV-1 positive sexual partner. It will actually reduce the HIV transmission to prevent. Now, a lot of times they'll give it to people who are negative with, risky behaviors or, out there. So that's one thing. But we have to make sure, even when they're on Truvada, we have to make sure we clarify. They always, 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 always use safe sex practices. And every 3 months, they need to be having an HIV test to make sure that they do not have HIV. And we need to monitor side effects of the drugs. So that's very important when we're talking about these pre-exposure prophylactic drugs. So we have to monitor. Like I said, there's new ones out there, but this is the one that we have in the book right now. And just the last thing I'm going to tell you is food for thought. Needle sticks. This isn't going to be on your test, just something to think about. Needle sticks, if you ever get stuck by a needle, you need to treat within 72 hours, okay? Usually if they do, maybe it's someone who has high-risk behavior, maybe they do drugs, or maybe, you got stuck by a needle in the garbage, you don't know who it is. Actually, treatment is usually 2 to 3 antiretrovirals that you need to take for approximately 4 weeks. And so think about all the side effects and adverse effects that are going to happen to you. Usually it will cost about $600 to $1,000. It's very important that you don't miss a dose, and you need to recheck the virus to see if you were exposed to it. So that's why it's very important, hopefully, if you do get stuck by a needle, that patient is present so they can do a rapid test on them to make sure that they do not have, the HIV right away. But you always want to make sure you get rechecked for exposure. And if you do take the medications, think about all those nasty side effects and adverse effects that are going to happen and how much you have to watch yourself. So try to be very, very careful with needles. I know it can happen. Things happen. Patients move. But I just thought that was food for thought, just so you would know. So that is our virus chapter. Any questions, you know what to do. So I'll see you guys.